This is Dr Vicky from Smile Design Studio. People always ask me, how does the TM joint cause pain like headaches, neck pain, ear problems? Well, basically, if you think about it, where the joint sits is actually related to where our teeth fit. So where our teeth fit here, the joint and the muscles have to sit. Now, as you know, our bites and our teeth and our smiles come out in all different shapes and styles and alignments. So basically, if your teeth are a little bit misaligned, and not necessarily just within themselves, you might have a perfect set of teeth, but if the teeth are not in perfect alignment with where the body needs to sit, because where the teeth fit is where the joints have to sit, and that's where we function, and that's where the muscles have to sit. So if the teeth were sitting in a place where it was not in harmony, perfect harmony with how the body needed to be aligned, we have no choice, because we've got to function, we've got to chew, we've got to eat, we've got to talk from where our teeth fit. So, and our bites change over the years. We lose the first set of teeth, we grow, we get another set of teeth that sometimes comes out crooked, we get teeth taken out, we have braces. So there's so many changes that can happen to our bites. And what happens to our bites and where our teeth ultimately fit is where these have to sit, and they have to adapt. And sometimes what happens is if we take teeth taken out and everything pulled back, maybe the jaw is pulled back too far, and then it impinges on the ear canals, and then it can cause blockages, in the ear or ringing in the ears. Sometimes it's too far back as well. It causes neck tension, or worst case scenario, if say the bite was uneven where we'd lost a tooth on one side and it started to collapse on one side, and we had a slight shift in the center of the jaw. So if the jaw joints were shifted this way or this way or this way or this way, it causes an uneven muscle tension across both sides of the head. And this can then cause a head tilt, which then can lead to neck pain on one side or both sides, and all the way down the spine. It can cause a curve in the back. Also, what can happen is that if the teeth have been worn down and they're biting up too far, it can then cause a lot of muscle tension up in the temporal area and cause lots of headaches as well. So what we often look at are all the different factors that may cause a difference in the change of the position of the jaw, which then leads to all these symptoms. And usually a set of symptoms will be related to a certain problem. So we can then look at the relationship and see how we can correct it long term, rather than just giving drugs and treating with the pain with palliative treatment of the symptoms only. We get down to the cause, and we use neuromuscular dentistry to do this. So if you want to find out a little bit more, have a look at our videos, but also feel free to give us a call and come in and have a chat.